Just to expand a little bit on my background, I am technically a medical economist. It's what I do every day for a living. It is a tough time to be a medical economist. When you tell people in the community, at a barbecue or a Little League game, they say, what do you do for a living? You say, oh, I'm a medical economist. They look at you for a second and they think about it, and then they start yelling at you. So without further ado, one of the reasons that I think you get yelled at if you work in healthcare these days, one of the reasons that healthcare itself is so difficult a place to work and so difficult a place to try to find clarity and explain what's going on is it's incredibly confusing and complex, and most importantly, it's burdened with a lot of expectations, a lot of cultural expectations, a lot of baggage in healthcare. And here's a really good example right behind me. Last November, the Reader's Digest, this was the cover story, November. Very apropos to the conference today. The new pill that can end aging. This is not the Weekly World News, this is the Reader's Digest. The new pill that can end aging. It's actually not new at all, it's called cyanide. The good news is it's actually available in generic form. You can get a great deal on it from Canada. They sell a lot of it up there. The new pill, this is what the typical American confronts when they confront the healthcare system. And this is what doctors and people in health plans and people in pharmacies have to deal with every day. It is a society of people who believe this is possible. And we have not a lot of reasons not to believe it, because every day you do open the newspaper, there are miracles. There are incredible things that we're accomplishing in medicine, almost despite the complexity of healthcare. We're doing some absolutely astounding things. And as a result, people have come to not just expect these miracles, but to take them completely for granted. And even worse, have the expectation that they're free. And that's a big problem. It's a problem for everyone in this room. And this is really the job of managed care all along. Job of managed care all along has been, and managed care really was an experiment that got started in earnest in the late 80s and is just now sort of grinding into its next phase. And basically that experiment was one of cultural re-education. To culturally re-educate people and say, look, not everything is a miracle, not everything works perfectly, not everything is appropriate, and not everything is free. And managed care's very tough job was to come along and say, look, we've got to change expectations culturally. Tough, tough job. And we learned a lot. We learned a lot of what we couldn't do in that process. I want to give you an example, really, of what I'm talking about when I talk about what managed care has been trying to accomplish all along, and a little bit of why it's worked and why it hasn't. Here's a very good example of the role of managed care, and in particular managed pharmacy. And I would contend it's really to keep Americans off the organic blue cornflakes. What do I mean by that? Organic blue cornflakes. Here's an example of a box of organic blue cornflakes. I like blue corn tortilla chips, and I'm in a grocery store, and I see this on the shelf in the cereal aisle. Wow, organic blue cornflakes. So I toss them in the cart. It isn't until I get to the checkout counter that I discover that organic blue cornflakes cost $5 a box. $5 a box. Because the yellow cornflakes cost $3.50. So what am I getting for the extra $1.50? Well, I can tell you it's not the taste. Stuff tastes like sawdust. No, it's actually written right on the cover of the box of the cereal itself, right under the word flakes. I don't think you can read it from your seat, so I'll read it for you. It says, made from the blue corn that the Hopi ate for strength. Ooh, the Hopi. The Hopi had a life expectancy of 19.4 years. That's why I'm pounding this stuff for breakfast. Now, in the Hopi's defense, actually, before we move on, I should say in the Hopi's defense, it wasn't their fault they had a life expectancy of 19.4 years. In the Hopi tribe, they didn't understand sinusitis or pneumonia. You had a fever and you're sweating and you're shaking. And so what they would do is they would throw you off the cliff. You would die. And then the tribe would move away. Which is interesting because that's one of those proprietary clinical protocols that Aetna got stuck with when they bought U.S. healthcare. So can anybody think of any examples of organic blue cornflakes in the U.S. healthcare system? In the pharmacy in particular? How about elsewhere? How about in procedures? How about, well, here's an example, how about the recreational MRI? I wish I were kidding. The recreational MRI. Here's a business that came out of nowhere in the last 5 years. It's now about a $500 million a year business, and it gives perfectly healthy people access to full-body MRIs, full-body scans. They're totally asymptomatic, they're completely healthy.